So, what's the time, Mr. Wolf? Oh, it's 1:05. All right, 1:05. That's my time. I don't know what's your time, but it's the time here in Trinidad and Tobago. So, good afternoon to everyone. I have a young lady in the studio here with me. Good afternoon to you, young lady.
Good afternoon to everybody.
I think your name is Adanna.
That is right. My name is Adanna Williams.
How long now? Shh, don't tell me. Don't tell me. Wait. Now, with that you sell out your age. And I don't know if you want everybody to know your age.
I'm quite proud of my age, but
Uh-huh.
yes.
You could tell me a secret.
44.
You didn't count how much you went to school?
Well, that was a real long time, so I'm allowed if I have forgotten.
Uh-huh.
Yes. Well, hopefully my colleagues from Monripo RC who I was in school with could message in or call in and remind us how long that's been.
I when Moses was in short pants.
Oh gosh, don't do me that now. It's not that long. That was just the other day.
Wait, because somebody tell me you owe Moses and Bob, you know.
Don't believe them. You can't believe everything you hear, David.
Don't believe everything I hear?
No.
Okay.
No. You have to touch and feel it first. So you can't believe everything you hear.
All right. I could touch and feel you.
I'll have to think about it maybe. Let's see how the interview goes. But those who know I come from good stock. Great genes.
Uh-huh.
We definitely don't crack any Williams family.
When
so
you say great gene, Levi? Anyhow, all right. Wrangler. Then anyhow.
Best of the best. True legend. That is what Gen Z will tell you.
Oh.
Yes.
Okay. Great genes.
Great genes.
All right. Okay. So wait, genes. That is for what part of Trinidad? South?
Yes, I'm a South girl. Bred in South. All of my formal education in South. So as I said, I'm a Monripo RC graduate, and I'm also a Pleasantville Junior and Senior Secondary graduate as well. I'm very proud of my Pville history.
Oh, you see, so you could go to junior second, senior second, still accomplish something.
Absolutely. I always tell people, it's not about where you start, but it's about how you finish and what you do in between.
Okay. So let me know what you did in between and how you finished.
Well, remember, we just have an hour, so I will try and keep it brief, David.
Right, yeah.
There was lots of stuff in between. So, in short, I finished my studies at Pleasantville Senior Comprehensive, and I did creative arts, by the way. Shout out to Mrs. Ajani, who was one of my wonderful teachers there, and moved to the UK and did nursing in the UK. I started as a mental health nurse and then trained as a therapist and worked in clinical practice for several years and kind of landed myself into policy and strategy and service development and commissioning. So at the moment, I currently work as an officer of the government. I'm responsible for policy and strategy implementation and design for autism, learning disabilities, mental health, and special education needs in one of our 7 regions in the UK. Southeast, big up. So I reached quite England and I'm still repping South.
Wait, now how you have time to do all that study, girl?
Well, you know, dedication, sacrifice.
Yeah?
Yes.
Wow. So wait now, Adanna. As you talk about this form of disability and thing, what is autism?
So autism is a neurodiversity, and I say people are like snowflakes, we're all special, and some of us have different source in there that make us a bit more unique. And autism can present itself in many different ways, and you would describe it as a spectrum. So some people are at one end of that spectrum where they may have little quirks and different bits about their personality that may seem different to the norm, and then there are others who need a lot more support and help because they may have some other challenges that they have to overcome, such as behavioral needs. They may have need some educational support and may need some support with various aspects of activities of daily living that align with their neurodiversity. But in short, they are special. And if you do have that diagnosis, you may find yourself in a very, very elite alumni, because there are many people in our society who have a diagnosis of autism but do some exceptional things.
But how you know? Well, how you know you have autism? What's the signs, symptoms of autism? You know, because I want to know if I have it.
I'm glad you asked me that, because I want to share with you all some research and some guidance that one of my fantastic colleagues who I've done shared a stage with and done some work with in Ghana has shared. So her name is Dr. Marilyn Marble, and she has Mission Pediatrics in Ghana, and she really helpfully outlined some key things that you could look for in your children to recognize it. And I have to say, some people get diagnosed in adulthood as well, because us as women, we tend to be the ones that are very skilled at masking some of these symptoms, and it sometimes get mistaken for other things. So there are three main categories that Dr. Marble told us that we need to be focused on, and in particular, delays in communication. So she talks about no communication by words when your child gets to about 2 years. So they might be singing rhymes and reciting the alphabet or numbers and labeling things. But in terms of them initiating conversation, they may not be great with that. And not pointing with the index finger to request or share interest and stuff. Sometimes they might not turn around or respond when you call their name. And you find as well that, you know, they tend to be delayed and repetitive with some of their speech. So these are some key things around the communication. The other bit is about social interaction. So those children tend to be very solitary in their play. They may not want to interact with peers, might not necessarily want to share, and play is inappropriate for their age. So they might be will mouth or chew or throw, you know, or spin toys, etc., or appear to ignore or sometimes be really snobbish with other people. So those are some of the symptoms, and really poor attention for some. And lastly, the sensory differences. So you find that there might be restricted interests and some repetitive behaviors. So may want to put everything in their mouth, may want to cover or plug their ears because they might have some sensitivity to noise, might flap their hand or stare at their hands as well a lot, especially the fingers. Some children might walk on their tiptoes, and some may have fixation obsessions with the alphabets, or be fixated with lights or fans or wheels or switches. So, but just to be clear though, folks, if your child presents with maybe one or some of those symptoms, it doesn't necessarily mean that they have a diagnosis of autism, but I will strongly encourage you to visit a specialist to have an assessment to determine if that is your child's diagnosis, because early identification leads to better outcomes.
When it leads to better outcome, is it that we have treatment for autism?
Absolutely. You could engage with educational psychologists. You could work with behavioral specialists. There are even changes that you can make to the environments that people function in. So that is work, play, study, to help improve people's capacity to engage and to learn. So there is so much you could do, and I'll give you a classic example. So remember I told you about those famous people who are in that autism school. So one of them is a friend of mine, his brother. His name is Jason Ade, and he has been recently appointed as one of the youngest Black professors for Cambridge University in the UK at 37. And this is a young man who did not speak until the age of 11. So he had the support and the intervention, and his family were really astute, and they recognized that perhaps maybe there was some delay with his developmental milestones. So he got support, and look at what he is doing now.
Yeah. But autism is something that you are born with, or something that you develop after birth?
No, it is you are born with it, and you can start seeing evidence of that neurodiversity even in very, very young children. But I always exercise caution when it comes to babies. I feel it's really important to give children a chance, but be mindful, but act quickly when there's recognition that something needs review.
So you are specialized in treating or attending to people with autism?
Actually, believe it or not, I am not. So my specialist area is primarily mental health, and in particular, brief psychosocial interventions for those with serious mental illness. So I specialize in therapy, but as I have trained and developed over the years professionally and otherwise, I've done other specialist courses that relates to what I do now in terms of that service development and strategy, project management for one, and various other things that have landed me where I am now. And I work in a big team where there are people who have got that subject matter expertise, and I have learned from them, and like other fantastic colleagues like Dr. Marble, whose work I referenced earlier.
So tell me something. Mental health. It seems to be a worldwide phenomenon. I don't know how dangerous it is. Is this something that you have to be scared about?
Absolutely not. All of us have propensity to develop a mental health issue at any point in our life. If you imagine that we're all on a line where one end of that line is really good mental health and the other end is where you need intensive support, at every point in time we will travel along that, and there might be different things, particular stressors, that will cause us to dip into one side or the other of that line. What makes us not perhaps maybe need some of those intensive services like inpatient care and medication has to do with our ability to cope and our level of insight. So let me explain that a little bit more. So when I reference insight, I mean your ability to recognize that you are experiencing a mental health problem and you need support. And when I say your ability to cope, it is what mechanisms that you have in your environment and in you as an individual to help you through this particular crisis. And also your support mechanisms as well to do that.
So mental health is a challenge, right?
Absolutely.
And what are some of the causes of mental health?
So like with autism, you can be born, I mean, researchers say there's been evidence to suggest that you could be born with a genetic predisposition to develop a mental illness. So for example, if you have family members, close family members who suffer with mental illness, you too may develop that if the environment is right. But also, as I mentioned, there could also be other factors that may trigger it, such as some people do have sensitivity to some drugs. I have seen people, I've treated people who took marijuana or hallucinogens that ended them in inpatient care because they were not able to process those chemicals and ended up in inpatient care. So it triggered what perhaps might have been a latent mental illness in them. But that being said, there have been twin studies where they've separated twins at birth who come from that familial background with major mental illness and have demonstrated that if you are in the right environment, as I mentioned before, with really healthy habits such as good sleeping patterns, great diet, routine, structure, all of those things, these are things that help to support you to maintain good mental health.
Now, mental health could be a very wide illness, if I could call it that.
That's right.
Now, if somebody is mad, it's a mental problem, right?
Yes.
If it is that I might be cussing you for no reason at all, mental problem.
Well, it depends on the nature of the problem, because there are many things that will come under the umbrella of mental illness. And what you might be describing might be somebody who may be suffering from a psychotic break or may have psychotic episodes. So, for example, a person who might be likely to swear at you or take issue with you with no apparent cause, maybe somebody who's experiencing voices, hearing voices, or having paranoia, so their perception and their beliefs about you might be altered and not necessarily aligned with the reality of your engagement with them. So then it will cause them to react in a way that is negative, antisocial, and typical to what we might perhaps see with some of our vagrants that we have locally. You know, it's so interesting that when I went and I did these studies, I was able to kind of understand and categorize some of the behaviors that we used to watch and laugh at or be fearful of when I was growing up.
Oh. So Adanna, so where you practice your profession?
So I practice in the UK, and I have been practicing in the UK for over 20 years now. So a long time.
What happened to no place like home?
But I am here. I am here. So I actually, so in the UK, and another place that is my second home is Ghana. So I do spend some time in Ghana doing charitable work as well, also related to these same themes, and also working with them on developing their health offer for those with autism, learning disabilities, and mental health too. So it's something that I would love to be able to come to Trinidad and do.
And what's the key back now? Or what could be the key back? Have you ever made an attempt?
Yes, at times. But I feel, as you know, in Trinidad, sometimes you have to know individuals who can help you to identify the path to that.
Okay.
And also with most things, you need funding and support. So in Ghana, I work alongside some charities who have sponsors that help, you know, to fund my time and my expertise there at times. So, you know, I still have to eat and live. So unless I have a way to do that here, then it's a challenge. Oh. But that being said, though, David, I do some charitable work here alongside my aunt, but it's not exactly related to this. She has a charity called Classes Class, and she is a breast cancer survivor. Yeah. So every year she has an event based on edutainment to support others who have been diagnosed, or just to raise awareness of the importance of checking yourself and getting screening and treatment.
But what would have pointed you in the direction of mental health and autism?
Personal experience. So I have loved ones and family members here and in other parts of the world who access these services. And it was really important for me to ensure that their experience of care is better, and also really important for me to leave a legacy of improved care, particularly for those of us who come from those Black communities in particular, or as we say in the UK, ethnic minority communities, because we tend to be disproportionately represented in those services outside of Trinidad. And even right here, you know, there is things that we can learn from those who are doing it abroad, and how we could refine and improve the experience of care for those we have in our communities here. So it was a real passion to want to make a difference, and I come from a family of people who are into public service.
Oh, so other than this forum, have you made any serious attempt to pass on your experience, your knowledge to the citizens of Trinidad and Tobago?
Yes, so I do it via my aunt's platform, and I also was trying to get into my old alumni in Pleasantville so I can share as well, and I do different events, and I also have my own personal platform that I'm building where I'm happy to share advice and you know, and I'm looking at how I could potentially hold some events to share some of the knowledge, because I think it's really important for people to identify a couple of things. The first thing is you can start as a nurse, but that does not mean that your destination has to be direct patient care only. You have a lot to add in a quality improvement and a strategic space. I think also as well, as an islander, because as you say, no place like home, I will always be a Trini. I think it's really important for us to understand what diasporans are doing across the world. I have many colleagues who are working in multiple industries who are excelling in the UK and wider. And as I say, they come from humble beginnings like myself. So I feel it's really important to have that visibility. So I use my social networks such as my Instagram. If you search for me, Adanna Williams MSc, you will find me. I use my LinkedIn to do that. And as I say, if you have a platform where you are doing this work that's aligned with my subject matter expertise, get in touch and I'm happy to support you because I do work with people virtually and in person.
Oh, right. So how long now you have been into this field?
Gosh, so officially qualified, as I say, over 20 years, but I've actually been working, I think maybe altogether about 24, 25. Oh my God, David, you have me thinking.
Yeah, well, at least your brain young.
Oh, yes. Depends on who you ask.
Yeah, but what would have taken you to Ghana?
So my very best friend, who I sadly lost in 2022, her family pretty much adopted me, I have to say, and they are Ghanaian, and they introduced me to the Ghanaian culture. I had my first visit to Ghana with them, and I fell in love. There is so much that they do there that is similar to us, and you know, you can see where our heritage comes from, and they embraced me there, really valued the contributions that I bring to the country, and it's a place where, you know, I feel safe, I enjoy life there, and it's really is like a home away from home.
Yeah. So wait, now what language they speak?
So they speak multiple language, but the two most prominent is Twi and Ga. I don't know. I have to learn, but at the moment I'm learning French. Okay. But I have to learn Twi and Ga. I do know how to say hello and goodbye. So at least those are the basics.
Say hello. Let me hear.
Etisend.
Goodbye.
I can't remember. Don't even put me on this one. But I was learning. But you know, I have my friends there. But in fact, most people speak English as well, so it's really easy to navigate.
Oh, right. And in your practice, you are in the United Kingdom right now practicing, right?
That's correct.
What is it like out there when you compare it to here at home?
There are a couple of things. So as a nurse, so my sister, who I'm very proud of, Tiffany Williams, she's a nurse with SWARA, and I visited her ward and spent some time there to see how they apply clinical practice in Trinidad. And I have to tell you, I was completely blown away by what our nurses in this country are able to achieve with sometimes very limited resources, and the innovation that they apply to keep people safe in those environments and to keep people alive and well. And so on paper, we seem to have more resources, but in terms of how we use them, I feel that Trinidadians have a bit more to show them where that is concerned. I feel like we can learn from them and they can learn from us. The other thing that I have recognized is that nursing as a profession has a lot more autonomy in the UK. So we have a lot of nurse-led services that really helps to increase consultant capacity in our systems, and I feel like perhaps that might be an area in Trinidad I would relish an opportunity to work on some policies and strategies to develop, because we have fantastic nurses, and where we have the nurse consultant role developed, which is the pathway I was on, we could do more of that in Trinidad. So we can perhaps maybe reduce some of the waiting lists, improve people's access to care, and various elements. There are some easy wins we can get from that.
Well, it sounds good, but you know, to get in there, how challenging it could be.
Absolutely. I know. Because it could be scary too, because when you're thinking about this from a ministerial perspective, any change requires investment and funding, and you also need buy-in. And, you know, a look at sustainability from a strategic perspective. So I can see how it's daunting. But there are others who have tried and tested it. So it's really important to take some of those lessons learned and the evaluations that others have done before and build on that.
Right. I think there was a couple other points that I wanted to elaborate on.
Yes. So for me, I think I covered some of them. So the key one really, and the key message across the board I want people to take away with: don't be scared of mental health and mental illness in general. And don't be afraid, because one of the things that I do a lot in Ghana is work on stigma, because we as a people tend to be very concerned with admitting that there is a problem or a challenge. And oftentimes we are our own worst enemy in that regard. So if you feel like things are not going the way that they should, ask for support. It takes a brave individual to do that. But you could actually end up having a way better outcome and a better experience and gain so much more value if you get that support early enough. And I'm speaking particularly to the mothers out there. If you recognize that your child perhaps isn't doing the things that they should be for their age, please reach out to your clinicians, get some help, get some advice, and get a diagnosis so you've got a known quantity to work from.
But you have to know what you're looking out for, or what to look out for.
Well, I will post Dr. Marble's her guidance on my platforms. It will be there, free to access. People connect. I have resources available there that you can access to give you some tips on where to look, because as I say all the time, and my mother would say, you know, this is one of my favorite lines. The internet is not just for Facebook. There are so many reliable sources that you can go to that can help you to understand a bit further what your personal experience is, or your experience of your loved one, and help to give you some really salient and safe advice on where you can get help. And can I say, though, it isn't lost on me that in Trinidad we may not have access to everything. But this is why I am saying we do have access to the World Wide Web, and YouTube is a valuable resource if you find the right space to go to.
So, you know, okay, you say now, you know, YouTube.
Yes.
Now, you will go on YouTube and you will see a lot of remedies, a lot of tutorials, everything. Which you have to know which one now really is of sense.
That is true. So I say you have to do your research. So before you wholeheartedly buy into any suggestion that is given to you, and as you say that, David, you reminded me of some of those WhatsApp broadcasts that people share. You know, this one auntie cousin send this and it's fact. No. Yeah. You need to do your research, and it really doesn't take much. You know, you go on Google, you put that person's name in, and really try to understand their credentials and ensure that they are somebody who is qualified to disseminate the advice and guidance that they are giving you, and that it is also underpinned by evidence, empirical, peer-reviewed evidence. That is your way to ensure that you are on the right path, because just like me, if you want to know about me, Google me. You can find out everything that I have been doing and verify my credentials, and you should be able to do that with any reliable professional person.
So if I Google Adanna Williams,
yes,
or never I'll say Adanna Williams love David Matthews.
Well, after today, I feel that might be the update.
Oh gosh!
Anything is possible, David. Anything is possible.
Oh, all right, good, right. So, this profession, is it something you really enjoy?
Yes, I enjoy my job for the most part, and I tell you the bit that I enjoy the most is that sense that I am really able to make a difference to many. I miss nursing, I will say that, because I used to see patients and do lots of therapeutic interventions with them, and I miss that one-to-one counseling and have opportunities to do that at points in time. So I miss that, but then I have to think of the bigger picture, and the bigger picture is the position I'm in now. I'm in a position to help hundreds of thousands as opposed to the few that I will have access to in clinical practice.
And what's the position you're in now?
So it's a long, long title, so let me take a breath.
Okay. Okay.
So I am a regional deputy director of nursing for one of the 7 regions in the UK, and I am also the regional head of autism, learning disabilities, and mental health and special education needs. And what that means is I am responsible for delivering our National Health Service's ambition for autism, learning disabilities, mental health, and special education needs care.
The page full.
Real full, eh? Real full.
You see? I mean, it's good to know, you know, these are things that, these are profession that you do and you enjoy. And I wonder if everybody really enjoy their profession or they're just doing it for financial reward.
Well,
you know?
Nursing in the UK, I don't feel is as lucrative as potentially nursing in other countries. I feel like we've got a ways to go in relation to that. And in terms of what you were saying, I have to make it really clear to people. My career path has been done with great personal sacrifice. So it really has been about my career development, and perhaps maybe other areas of my life had suffered because of it. So now I'm trying to get some balance. I keep saying to everybody that that is my word, for one of my words for 2025. Or 24, sorry. I'm going ahead. 24 and 25, actually.
Right.
Yes.
Oh, okay. So you have a roadmap now.
Yes. Any good strategist will have a roadmap, David.
Oh,
yes.
Okay. So you've been studying for the last 200 years. And now it's studying over, so you're studying something else now.
I'm worried about where this is going, eh? But
okay.
I wouldn't necessarily say that I am studying it, but I am giving it a bit more focus. How about that?
Yeah.
Yes.
Yeah. You're giving it more focus. Right?
Yes.
Good. It's a good practice.
Yeah. I mean, we need to get the work-life balance right?
Yeah.
So I get the work side right, so now I have to get the social side right.
Social side.
Yes.
Right. And you're still young. You have plenty time.
Well, that's true.
Yeah.
And remember the good genes.
Oh yeah, the good genes.
Yes.
I can't remember the brand.
True religion.
Oh, it shall be William.
Well, listen, there's time, because another thing I like doing is sewing. So, I've always said one of my best mates, sadly I lost her some years ago. She had a fashion line. Her name was Nicole Edmond. And one of the things we always used to say when we were growing up is that we will have a fashion line. She got there before me. So I still have to get there too.
Oh, right.
So, yes.
But then, other than studying, what are some of your hobbies?
So I mentioned about me liking to design and make clothes, so that's one thing. I also like to draw and paint, which is something I inherited from my father, so when I get time I do that. I also like to dance, and I like going to the theater, and I really enjoy fine dining and trying new foods. And more recently I've added a little bit of travel to that list, because I feel like there's lots to see and do in the world. So those are the things that I enjoy for the most part. And also doing here, I know my mom will say, and she ain't talk about here, so I like doing here as well. And if you get on a good day, I like cooking.
You like cooking?
On a good day.
Oh, well, apparently like no day is good then.
That's what my mom will tell you.
Oh, on a good day, because we never know which day is a good day. Oh, you see? But so you home for Carnival?
I am gonna be around for Carnival, yes.
Oh, all right, okay.
But this is not the primary reason, but it's a happy consequence.
Right. At least you're home for Carnival.
Yes.
Yeah. When last you experienced Carnival?
Oh, I was here. So I am in 2020. Was my last carnival, and I played with Yuma in a costume that really spoke to me.
Okay.
So it was called Dingole, because that is one of my favorite calypsos because of the words.
Yeah.
And I love David Dwyer's design. So David, if you're listening, I didn't get in any section this year. Call me now.
I'm listening.
Yes.
Adanna, are they talking at? You talked 2020 and about the last time you were here and that kind of thing. So, as you are in the profession of medics, well, I say medics, but let's say health. Um, it is very serious. I have to ask, is it serious right now for, um, okay, let me put it differently. We have been scared again.
Oh,
We have been scared again. Somebody's frightening the world again.
about COVID?
Yes.
Do you know what one of my roles was? I was one of the national program leads for the vaccination rollout in the UK when COVID originally hit.
Yeah.
So I kind of feel like I have a special relationship with COVID. And I you know, I have to let people know it never went anywhere. I feel like the prevalence just reduced and people, the virus evolved and people's responses to it had changed as well. You know, and
Right.
it would be remiss if I don't say that, you know, elements of the immunization programs that existed supported some of that to a degree. But I feel like it is important to be vigilant about all health related issues, not
Yeah.
just COVID, because there are many other things that are communicable, just as communicable, and could be a lot more damaging if you don't address it well, such as TB and other things. So for me, if you stick to certain principles that relates to hygiene and, you know, ensuring that you've got that awareness, then
Yeah.
you will continue to be safe. That is what I
Oh.
say.
But Adanna, so you were out there
Yes,
and were you scared for your life?
absolutely. When, you know, you are being told that you need to be prepared to actually take up a response and manage a hospital in case the directors in the hospital get shut down, and, you know, and you have people suggesting potential military intervention and support to manage this.
Yeah.
It was a scary time, and, you know, and rightfully so, because we were faced with a challenge unlike any other,
Yeah.
and really had to develop solutions to support and keep our population safe. And of course, as somebody who come from the Black community, you know, we too were disproportionately affected by COVID and tended to have poorer outcomes in relation to COVID and treatment. So of course, it was an absolute scare and a worry for me.
Wow. Because now they're talking about the upsurge again.
Yes. Yes.
And I don't know, they're trying to put the world into another lockdown again. You feel like it happen, girl?
Well,
Just say no. Just say no.
I mean, anything is possible is what I will say, but I think it's the onus is on us to be proactive. So if we, as I say, consider the principles that we had in COVID times, where we were hand washing more frequently, you know, being really mindful about the kind of contact we had with people, keeping safe distances, wearing masks at certain intervals. I believe if you really follow some of those key principles, then you should be safe. And I think for me personally, it's those people who are more vulnerable.
Yeah.
Such as those with additional illness. So if you already have a respiratory related issue, or if you're immunosuppressed, or have multiple other challenges, then I believe you are the people who need to be a bit more vigilant and mindful about your practice and interface with others.
Right, yeah, because those are the people that are vulnerable.
Absolutely. Absolutely.
Because even when the blast hit us for 2-3 years, these are the people who really suffered.
Yes, and some of them were suffering because of their relatives who were not taking care, you know. So all those COVID parties, you know who I'm talking about.
Yeah.
Or people who were coming home and not really changing their clothes and interacting with their family and passing things on and not really being mindful of their vulnerability are some of the ones that really created the issue here. So as I say, it really just needs, you know, a bit of proactive action, being mindful, following the guidance that's issued to you, because we really have to trust our healthcare professionals who've taken time to learn and understand what works, and not Jane and Sally Sue who sending you the Facebook and the WhatsApp chain.
Right. And,
Yes.
and everybody want a bush doctor.
Right, right.
So as we get ready to wrap, Adanna, if anybody wants to find you and get some more info on you, how can they find you again?
So you could Google me for a start.
Right.
And also I have an Instagram page, so Adanna Williams MSc, and I also have a LinkedIn page where you can find me, which I have to say I cannot take full credit, and I also have a Twitter, by the way, which I can't take full credit for. I get a lot of help and support with my content there by my wonderful friend Jimmy Ann Warner. And you know, I cannot thank her enough for everything that she does to support me and all of my ambitions philanthropically and in my professional career.
Okay.
And she's based here, by the way, let me tell you. She is actually right here in Shogunas.
Okay.
So if you all want elite social media, you have to hit her up.
Right. Oh, what's her name?
Jimmy Ann Warner.
Oh, okay. Okay, we'll warn her. Right.
Behave yourself.
All right. Did we forget anything?
No, I hope people found value and you were able to learn something, and or even you know, think a bit about how you can help yourself or potentially others. And as I say, you know, I have some materials there and things, and really open to coming to share this message in multiple forums. So I'm here for a little while, as I say.
Yeah.
So if anybody wants to reach out, please do.
And you specialize in what area?
So that is mental health, learning disabilities, autism, and special education needs.
Special education needs. That's
Yes.
one of the areas we didn't touch. You could just give a brief.
Well, you know what, David?
Special education.
We didn't go into it explicitly, but
Yeah.
we did cover some of it in terms of developmental needs.
Right.
So it's primarily more about identifying those children who have additional learning needs or things and diagnoses and different traits that may impair their educational development. So what my role is about ensuring that we get early diagnosis for those children, understand what those needs are, and that they have a supportive plan that's been agreed to help them get the most optimal outcome from the education system. And if they require support, that they are signposted to the right support. And this is what we do in the UK. So somebody like Jason, for example, when he was coming up, he might have had something called an education and healthcare plan, which a number of our children will have, and it can cover you up to the age of 25. And it really sets out what education specialists have to do to support your learning.
Great. Well, what's my special need, boy? Anyhow. All right. I'll find out.
You don't have none.
I don't have none?
No. No, I haven't. In fact, I haven't detected any as yet. But I'm mindful I haven't had an opportunity to do a full assessment. So people, assessments take time, and that's an important thing. I want to let you know. An autism assessment isn't a 5-minute interface. It can take days sometimes and several hours of dedicated inquiry. So we might need more sessions, Dave.
Take time to know?
Absolutely.
Oh.
Yes.
Right. Okay. Yeah. Well, we'll need more sessions, so we'll have enough time to dissect and to know exactly are you suffering from?
Yes.
Oh, right. Okay. Well, Adanna Williams, wanna thank you very much for being on WAC 90.1 FM with us here today, and hope it's not the last time.
Well, I hope so too. I want to say a huge thank you to you and to my aunt as well, who is the one that spearheaded this. Her name is Arlene Simon, and she has Class. You need to check her out. And it's been a real absolute privilege and a pleasure to share this platform with you, David. And as I say, I really desperately hope that is not the last time. I look forward to seeing you again.
We'll find you.
Yes, sir.
We'll find you. Leave your contact.
Yes, I will.
So we'll know how to find you.
Yes, indeed. Take good care, everybody.
It's like somebody have a mental problem and they want to find out something.
Oh.
Hi, good afternoon.
Good afternoon, David.
Hi,
Taking no call.
Well, well, you call now. Okay.
First of all, let me say welcome fully grew up very close.
Change your position. You're breaking up a lot.
Yeah.
Yeah. So always so eloquent in talking, especially mental illness and so on. She almost make you want to, go and look yourself and when you because she make it seem like something
Yeah.
like like you're mad. And that way to involve in what is going on. We keep an eye in San Fernando. We don't watch.
Okay.
So
No, in Pleasantville. In Pleasantville.
Yeah, we could find a way to have her involved in, doing some of the works here so that we could benefit from, all that training and expertise that she has so eloquently displayed here this morning.
Oh.
Yes.
Right? So, David, we have to talk to some people. You just have people on your show.
Yeah.
We have to study talk.
Yes.
Right? Promise me.
And it started today.
Very well.
Yes.
So, Adanna,
Sir,
here. Well done.
God bless you, sir, and thank you so much
Bye-bye.
for that really wonderful feedback. That really has touched my heart. Thank you.
Okay.
Thank you. Wait now. I had planned on touching your heart,
But you already did that. You invited me, you welcomed me. So, of course, you already did that. We're friends now, David.
Okay, then good. I feel in my heart. It beaten. Thank you very much,
so
Adanna.
nice.
And we'll be in touch again. And all the best to you in your medical profession.
Thank you, sir. And take care, and God bless everybody. Bye-bye.
Me too?
Yes, you too. Of course, you too. You especially.
Okay, thank you.
All right. Bye-bye.
All right, my girl.